name, last name, and spell them both for me, please.
It's Marianne Levstick, and you want me to spell them?
Yes, please.
Okay. Marianne, L is in Larry, E is in Edward, V is in Victor, S is in Sam, T is in Thomas, K is in Kenneth.
That's the end of the test.
What's that?
About why you started to see Brian and what he's been treating you for. And then you would start the statement with, I started seeing Brian too.
I started seeing Brian about 10 years ago. I was very, very unfortunate to inherit from my parents arthritis, severe. I have stenosis of the spine. I have arthritis in both of my hands and really bad in my knees. And through Brian, I was introduced to a medication that gets injected into my knees that has kept me from having 2 knee replacements done. He has great follow-through. His staff is outstanding. Jennifer is one of the nicest people I've ever met. And you are always met feeling that you're part of their family. None of them related, but you feel that way, that it's part of a family. If I have a concern, then Brian follows through on it. I never, ever feel rushed. I feel that there is always time for questions. And if the question or the answer is not readily available, then Brian researches it out. He might have me have x-rays, he might have me some blood work, and then we meet back again and follow up with it. So I would go to a long distance if I didn't, to find him again. So he's a great guy. I think I already sort of said that.
I think they're in there, so I'm just going to ask you to kind of rephrase that. Okay?
What I like best about working
Okay,
with...
I'm going to stop for a second because I think I walked on you there. So go ahead.
Okay. What I like best about working with Brian is his deep interest in you as an individual, that he takes the time to listen to what I have to say, because I'm a firm believer that you know your own body. And I think that he feels strongly about that. I like his follow-through. And probably the thing that I like best is that he really cares about the people that he takes care of. Thanks to Brian and Tri-State Pain Institute.
Let's start again.
Okay. Thanks to Brian and Tri-State Pain Institute.
Okay. All right. So you can tell us again. Thanks to Brian.
Thanks to Brian and Tri-State Pain Institute, I am able every Thanksgiving to go out to Park City, Utah to visit our daughter and our grandson and my son-in-law and my granddaughter, and we hike. And he always asks me, so what's next on the schedule? And I say, well, we're going to the canyons. And he goes, oh, that's a lot of walking. And I said, I know, I've got to be prepared. And he makes sure that I'm capable of doing that. And I see him at least twice a year in regards to this type of thing. And he really helps me to continue a quality of life that I truly enjoy.
Great. So,
thanks to Brian and the Pain Institute here, I am able to go hiking with my grandkids in the mountains of Park City, Utah.
great.
Well, I really sort of think we covered that, because the majority of it is the injections that I receive into my knees, yeah.
Okay.
So I don't know if you want me to restate that.
No, I think we have that. So that would be
Yeah,
your answer.
that would be my biggest, because that's
Okay.
the purpose of me being here. So.
Before,
Let me think. Before I started seeing Brian, I was treated by an orthopedist who at that time said maybe you could have 5 years without having complete knee replacement. At that time, I had a lateral release of the tendon on my right leg. Since then, I'd had a ruptured tendon in my left leg and had major surgery with that. So I'm doing things that the orthopedist didn't think I would be able to do 5 years later. So.
Okay. So maybe,
With Brian's help, I've been able to do things that other doctors, including my orthopedist, didn't think that I'd be able to do beyond the 5 years that they gave me.
good. And then if you would start with, I would recommend Brian and Tri-State Pain to someone with arthritis because.
I have recommended Brian and Tri-State Pain to a number of my friends who are having difficulty with their arthritis. I don't know that he's a magic man, but he certainly has helped me.
Yeah.
It's a maintenance.
Excuse me.
It's a maintenance is what it is.
Yeah.
So I don't know that there's anything brand new that's out there that's going to make any big difference in my life.
Right.
Age certainly, if I could turn down the clock, it might help a little
Yeah.
bit, but I'm not going to be able to do that.
Right.
So, like I said, I think I'm very fortunate at 73 that I can do the things that I'm doing, and I think about my parents and especially my father. He never did many of the things that I'm able to do when he was in his late 60s. So I feel that, like I said before, I think knowing your body is so important, and knowing what your limitations are. I'm allergic to most pain medications, so I have to be very cautious on what I do, and I have to know how to manage my pain, which I do know how to do that. So.
Excuse me.
First name, last name, and spell them both for me.
Okay, it's Patricia Cubero, Patricia, and Cubero is Cubero.
See Aaron and your choice of him, and if we can, it can be as simple as my husband. My husband had seen Dr. Thomas for a number of years.
Okay.
But when I had pain, Dr. Thomas recommended that I see his new physician assistant, Aaron, and we've been working together since then, something like that. So,
Okay.
again, how did you come to Tri-State Pain?
Well, my husband is a patient here and has been for many years with very good results. The compassion that they show here and just the energy and the results are always positive. So when my pain began and I went to my PCP, of course, to find out what could be done, he did some tests and evaluated me and ultimately said I would benefit from coming here. So I did, and Dr. Thomas introduced me to Aaron, and I've been working with Aaron with really positive results.
Great. Very nice. Some thoughts there.
Yes, what I
Okay.
really like about
So,
Aaron.
yeah, so when we say that,
Sorry.
I'll throw it to you, but then you would say, what I like best about working with Aaron is that,
Oh, yes, okay.
so go ahead.
So what I like best about working with Aaron is that he treats the whole person. When I'm talking to Aaron, I feel like he's talking to me, not at me, and my pain is in my neck or in my hip, but he's treating me from my face down. He's compassionate, he listens. If I have a question, he answers my question without just going to the point of maybe what the problem is. I'm very confident when I'm with Aaron because he helps me understand my problem and the resolve, not just this is what I need to do. He explains why, which for me is a big thing.
Great.
Is that too long?
No,
Sorry.
we can work within that. I came to Tri-State Pain because,
Okay, I originally came to Tri-State Pain Institute because I had very severe neck pain. It was causing headaches, numbness in my arms, and it wouldn't just go away. It persisted and got worse. So I needed to come and find out if there was something seriously wrong, if it could be controlled, ultimately surgery, which I feared, but that was why I originally came.
Not doing injections or?
Yes, okay, so it includes medication, injections, I've done some therapy, and monitoring at this point. So we're in between because the injections are working along with the medication, but there's some issues now, so I don't know. And I know you weren't going to get into that, but
And would you consider, and has this been?
to avoid if possible.
Right.
So my treatment,
And so go ahead.
okay, so my treatment is rather conservative. Aaron has suggested a conservative approach, which I'm really happy with, because with some of the medication and then helped with the injections, which Dr. Thomas distributes, right in the locations, they seem to give me quite a bit of relief at that time. So for now, we're going to go with that method, and hopefully in the future, I won't need surgery, but I'm sure they'll guide me if and when that should happen.
Great. So,
So in the past, my husband and I have had to travel out of Erie for his treatments and for relief and some injections. So having Tri-State here in Erie is so convenient and really helpful.
excellent.
Is that good?
That's right. So I would recommend Tri-State Pain.
That's a
because-
hard one, because there's just so many things. So how do I help me cut this down so
well,
that it's the most advantageous to them, to you?
Yeah,
Because I have a lot of opinion about that. So
I would recommend Tri-State Pain because they offer
a
people here.
big attraction for me. It's not just the doctors. If you can't speak to someone
Right.
and have them understand
Right.
what your need is or the severity of it or not, then it's really hard to get past that. So,
Sure.
yeah. Was that?
So maybe we could say that they have proven, relief, and the people that I'm comfortable with.
Okay.
Is that something like that?
Yeah, something like that. I'll just, yeah.
Does that
I think,
work for you?
okay. So for me, Tri-State Pain offers the perfect combination of the best technology, the newest approaches in pain relief, and the perfect people to work with. I'm sorry,
It's okay.
I've lost
Tri-State Pain offers the perfect.
my track of thought, sorry.
Tri-State, for me, Tri-State Pain Institute offers the perfect combination of the latest technology, relief from pain, or pain relief, and people who care.
Okay. So for me, Tri-State Pain Institute offers the perfect combination of pain relief, the most up-to-date technology, and great people. Did I leave something out again?
It works.
Okay.
No, that's right on the.
Thank you.
First name, last name, spell them both, please.
Dan DeRocher, last name DESROCHERS. I chose Dr. Ma because I was referred to him by my primary care physician. I had been experiencing a lot of pain issues. I still am, but now it's under control. And you need to go to an expert. For minor pain, sprains, things like that, you can get away with having your primary care doc provide something for you. But when you're having pain on a protracted basis, you really need an expert, and I have found the quality of care here at the Tri-State Pain Institute to be excellent. I am still under their care, and it has really improved my quality of life.
What can you, if you think about it, when you just I can blank, you fill in the blank.
Well, thanks to Tri-State Pain and Dr. Ma, I can spend weekends with my family. It used to be that the only thing I could do was work, and at the end of the work week, I was exhausted, I was down, I was in pain, and I would spend the weekend recovering so I could endure another week's work. And now it's not like that. The weekends are much better, the time with my family is much better. I have 2 teenage boys, so I have a finite amount of time with my family available to me before they move out of the house. And the quality of life is so important to me, and that's really what the Tri-State Pain Institute has brought for me and my entire family. I came to Dr. Ma because I have chest and stomach pain that occurs frequently throughout the day, throughout the week, and it interfered with every aspect of my life. I was constantly short and angry and snapping at people because of the pain, and you don't realize the effect, the toll the pain takes on other people. And in many ways, I come to Dr. Ma and Tri-State Pain Institute for the well-being of my family as much as my own well-being, so that you're tolerable at home, so that you're not jumping at everybody all the time. And the pain relief has really made life much more livable for me. Working with Dr. Ma, my treatment has included a multitude of tests, diagnostic, trying to figure out what exactly is wrong with me, what's causing the pain. I've got a couple of different issues that are making it more difficult to navigate through, but he's been excellent to work with in terms of getting the pain meds at the right level, using different treatments, eliminating treatments that don't work. A lot of times in the past, I had been exposed to something of, that's pretty much your option. But when you're dealing with a pain expert, they've got a wide variety of different medicines, of different treatments, of different things that they can do. We've worked our way through some of them. I found some that have worked better than others. And he is constantly tweaking my pain medicine and my treatment so that I can constantly improve and at least have a quality of life where I feel like I'm getting better.
I'm going to ask you to read them off and Tri-State Pain Institute.
Well, I would refer anybody to Dr. Ma and the Tri-State Pain Institute for a few different reasons. One of them was he actually called me when he made a change to one of my scripts, that my phone rang and it was late on a Friday afternoon, and he called me himself to tell me that he was making the change, and he wanted to tell me himself so that he could make those changes before the weekend happened, so I wouldn't have to wait until Monday to get my medicine. And that personal extra step really meant a lot to me. His staff has been terrific. I tend to take the morning appointments when I can get them, and I am always in and out in a very timely manner. It's not any of this long waits like at the other places. I really feel that they are concerned about my time, and anytime I need a refill or have a question, if I stop by the office or I call the refill line, everybody is courteous, they're polite, they're helpful. With my issues, I deal with a lot of doctors' offices, and I can tell you I am most impressed with Dr. Ma and the staff here. They have been absolutely terrific to work with.
Can you just feed me the line?
All right. To you, to the camera.
To you.
If you're in pain, try. All right, what was that? If you're in pain, Tri-State Pain can help. All right, I'll get. See, now that I'm scripted,
Yeah.
I'm way. If you're in pain, Tri-State Pain can help. It's Tri-State Pain Institute. I need to say that. Okay.
You can do it both ways, actually. Go ahead.
If you're in pain, Tri-State Pain Institute can help.
High school?
Yeah, no, from single digits, when I was really, really young. I used to do springboard diving. You say my name now?
Yeah.
Sally Capotis. Sallie Capotis. I was trying to figure that out. I think it might have happened in 1967. We were up in Port Huron, Michigan. I mean, you're really like making me search for things.
Back then.
Mm-hmm.
Jeez.
Yeah.
And then when did you first start to have, did you?
I've always had symptoms like brushing my teeth. My knees would give out on me, so I'd always brace myself
Like
brushing
as
my
a
teeth.
teenager and
Yeah,
stuff?
always. I always had
Really?
issues, but it wasn't until I gave birth to my third child that I realized I had problems. I herniated 2 discs during delivery, and multiple issues happened.
Right.
So Joe is actually my third person to see for pain management.
So if you could say back to me,
Okay, yeah, I had one person that I thought she was a quack, but I can't say that. And the other one was a reputable doctor that had me on a drug regime that there was no way I could take care of 3 kids under 5 and work. I would fall asleep. And I am not a pill popper, so I stopped that one. So I just need to make sure that
yeah,
we, you know,
sure. But
So-
you could make, just shorten that. I tried, you know, I saw.
a pain management, I saw a pain management specialist, and I saw a doctor that recommended pain pills, whatever you want to say, or I should say a regime of,
None of those worked.
no, no,
Yeah.
didn't like any of it.
So let's start with is that. Tell me about before you saw Dr. Thomas. Before I saw.
Before I saw Dr. Thomas, I saw 2 other pain specialists and did not get the success that I was led to believe that I would.
Excellent. We like the answers. So I came to Dr. Thomas for relief from,
I came to Dr. Thomas for a relief of lower back pain. I had 3 children under the age of 5, and I just couldn't keep up, and I couldn't sit, and I had a lot of pain.
so let's talk, thanks to Dr. Thomas and Tri-State Pain Institute, I'm able to do what, you know.
Okay, do you want me to repeat that?
Yeah.
Okay.
That'd be great.
Thanks to Dr. Thomas and his staff at Tri-Pain Institute, I'm very fortunate to have great quality of life. I am able to participate in all the activities that I like to do.
Let's try that one again.
Okay.
Just a little bit, we stumbled.
Yeah. Okay.
What are some things you like to do?
Okay.
I'm just out curious.
Oh, swimming. For a long time, I couldn't
So
swim.
thanks to Dr. Thomas and Tri-State Pain.
And I couldn't
I've been
kayak.
able to swim again, and
Kayak
again.
and golf.
And golf, yeah.
Okay. Thanks to Dr. Thomas and Tri-Pain Institute, I am very fortunate enough to be able to do my activities again. I like to play golf, I like to swim, and I like to kayak. Is that okay?
Yeah, one more time.
Okay.
Lose the Tri-State Pain, we won't worry about that.
Okay.
Just say thanks
Okay.
to Dr. Thomas.
Thanks to Dr. Thomas, I have quality of life again. I'm able to exercise, I enjoy playing golf, I enjoy swimming, and I enjoy kayaking, and they're all part of my life again.
Great. Excellent, right on the money.
My treatment includes coming in to see him, and he'll review what it is that my problems are, and if I need an MRI or an X-ray, I'm fortunate enough that he's able to do that here, which is a one-stop shop for me. Then afterwards, he'll review everything with me, and then we go from there. I'm fortunate enough that he's here that I can come in and schedule to have my shots. And usually they're scheduled 2 weeks apart, and I come in, and I usually am one of his earliest patients because I have latex intolerance. I guess doesn't matter. You don't need to know.
Stay here with me. That kind of- So we're talking about, what are we talking about?
What your treatment's
We're
doing.
talking about your treatment.
Okay.
So with Dr. Thomas, my treatment plan includes injections, etc. Medication.
Okay. With Dr. Thomas, my treatment includes having 2 injections 2 weeks apart, and then medication as needed.
Good.
Okay. Do you want me to wait before you start? Do you want me to, like, when I first started, I went to Cleveland. I went to, because there was nothing around here, or at least that I was aware of, and who I had been exposed to, I didn't want to go to anymore. Okay.
So you could start with when I first started pain treatment.
Before you start, give me a starter.
I'll give you the cue.
Okay. Okay.
When I first started pain treatment,
Okay.
I actually had to go out
Okay.
of the area.
Okay. When I first started pain treatment, I actually had to go out of the area. I went to the Cleveland area. And with the issues that I was having and the pain, being in a car was extremely uncomfortable. So I found it, honestly, to be a blessing to have Dr. Thomas and the Tri-State Pain Institute local. I personally think the strengths of the center are not only Dr. Thomas, but his staff. It's a clean facility. It's easily, we'll start again.
Easy to get to.
Yeah.
Yeah.
Convenient, accessible. Okay, start me up again.
All right. So what is it that you think is what's best about Tri-State Pain?
Okay. The one thing that I find, I don't like that either.
Yeah.
We're going to start again. Okay. See, when you said best, you changed it on me. Okay.
All right.
God, this is breathe.
It's all right.
Okay. Okay. Can we change it around? The reason I come to
Yeah,
Tri-State.
the reason you come.
Okay. The reason that I come to Tri-State Pain Institute is because of Dr. Thomas and his staff. The facility is easily accessible. When I come, got to stop. Okay.
That's all right. Because we have that right up to Dr. Thomas and his staff. So then you can pick up from
Okay.
there. When you come, what were you thinking?
Well, like when you come, it's like parking is easy. You got the elevator, you come up, you sign in, they get you, they take you back. It's like a one-stop shop. I don't want to say
Yeah.
they herd you through, but it's
No.
it's
But
very
you could
easy.
say from parking to checking in to seeing the doctor, everything is very convenient.
Okay. Okay. How do you want me to start?
We could just do a pickup, couldn't we? Or do you need it from the beginning?
The one thing that I find really nice is that once I park and I come into the building, it's just everything is easily accessible for me from the moment I come until I leave. Is that okay? You're looking, are you okay? MRI here in my x-rays here. I don't wait forever.
Let's talk about
Okay.
that. What services do you use here at Tri-State Pain? At Tri-State Pain,
At Tri-State Pain, I also use other services that he has here. I use his MRI imaging and have my x-rays here. And one of the main reasons I do is when they say my appointment is at a specific time, when I come in, my appointment's at a specific time.
Great. If,
I have recommended Dr. Thomas and Tri-State Pain Institute to my family and my friends. I have not been disappointed, and I don't expect them to be either.